ADHD, attention deficit hyperactivity disorder. It is a medical term that we often hear, but we may not know really all that it entails. So Dr. Zoe Martinez with Dunn Clinician is here with us to answer all of your questions about the disorder and other impairments as well. Here's what we want to do. We want to get your questions in front of our experts. So this is what you do. You text your question 336-379-5775. You text in your question. It is anonymous, but we answer your question live on the air. All right, so Dr. Martinez, let's just start with the basics, right? Let's get the definition. What is ADHD and who does it impact?
So thank you for saying the whole name of it. So attention deficit hyperactivity disorder is a brain disorder that has symptoms in multiple areas. The three main categories of symptoms are, I'm going to start with the first one, attention. So problems with attention, difficulty completing tasks, misplacing things, distractibility. Then the second category was hyperactivity. So excessive movement, and having a hard time sitting still, restlessness, and then impulsivity. So sometimes doing things without a lot of judgment. It's a disorder that was originally primarily diagnosed in childhood. So when we think of someone, the most typical ADHD patient, they might be a kid who's running across the street, making fart noises with their elbows in class and jumping on top of their desk and not getting their homework done, forgetting their backpack. Those are the most common symptoms, and because it was thought of as a childhood disorder. We now know that it impacts people across their lifetime, although generally adults struggle less with the hyperactivity and impulsivity, so they tend, as adults in general, have less energy. They don't tend to exhibit as many of those disruptive behaviors, but what we're learning more is that the inattentive part, so the problems completing tasks, especially when the tasks are boring, they require sustained attention, they require potentially working in, for example, a noisy office where there's lots of sound inputs. It makes those people continue to struggle with those symptoms, and those people often don't seem to outgrow.
All right, well, let's kind of like go down the line. Like, for instance, how can you tell if you have ADHD? What are some symptoms? Different in adults versus children. So let's go to children first.
So I would say in children, probably the most likely place, if a child is in school, it's a little harder if they're homeschooled, but if they're in school or they're in church or they're in some kind of organized sport, the person that might be the most likely to notice first would be teacher, coach. It could be like a Sunday school teacher. That child might be disruptive. What we're getting, I think teachers are getting better at, and I have to give them credit, is noticing the kids that are quietly having problems with attention. So they might say the kid's not turning in their homework. They're losing things, or they seem like they're there, but they're just looking out the window and doodling on their paper. So they may not be the disruptive kids. Those ones usually get picked up pretty early. The non-disruptive ones would get maybe picked up only when it seems like they're smart, but they're not getting their work done.
I see. Okay.
I would say for
and so
teenagers.
Let's go on to, so teenagers have different than children?
So teenagers may have, sometimes their parents might have picked up on the fact that their kid has a lot of energy. So some teenagers, even maybe in middle school, maybe they got into sports. So they found some way to burn off some of the energy. For kids, it's hard because if they're young, they only have recess and not that many activities. So it's possible that they have some outlets for their physical energy, but then they're still having trouble in school. They still might be losing homework. They still might not be getting assignments done. They might be the kid that's smart in class, but then does terrible on a test because during test time, other people are making noise or clicking their pencils or whatever. Or it might be a kid that seems like they're fidgeting a lot and isn't able to completely sit still in their desk, so they're squirmy. So those are things. And I'd say for a teenager, it's probably most likely going to be a teacher that will notice. For adults, a lot of times adults are kind of on their own. So occasionally they might have a sensitive manager or coworker who might comment on them, but they're not paying attention in meetings, so they might be doing some of the same kind of behavior. If a conference meeting goes on for too long, they're the person who's banging their pencil on their desk. They're making excuses to get up and go to the bathroom, and then they're having trouble completing complex projects. So sometimes adults don't get diagnosed until they get to the level of either in college or, for example, at work, where the workload starts to get really high. So they found all these ways of compensating before, sometimes staying up late, a lot of times by being very intelligent, which helps. But then they get to a workload or school load that just becomes unmanageable, and they're kind of not living up to their potential. And that's where either if they're a youth and they're in college and they still have a parent, they might have a parent and or a professor that might comment to them. And if they're an adult, they might have to ideally have a nice supervisor or a colleague or someone that says, hey, or themselves just says, hey, I graduated from college, but I'm having a lot of trouble in my job, or I just got a promotion and all of a sudden I'm in charge of the shipping, for all of these things. And now I have too many tasks. I have too many things to do on the computer. People are emailing me, texting me, and I can't do my job.
Okay, interesting. All right, and I'm sure people can kind of see themselves in those explanations that you had. What about women? Do symptoms differ by gender?
So not 100%, but yes, that's a very good question. So as I kind of mentioned, so the kid that quietly is sitting there staring out the window, doodling, or the person who's kind of often very well behaved and quiet, but just not doing very well in school, that's more common. Those symptoms are more common in females, and that continues across the lifespan. And then I think that unfortunately, for a variety of social reasons, I think females are more likely to internalize. They just think, I'm not that smart. I'm not that good in school. I'm not, maybe this class is too hard for me, or maybe this college was too hard, so they might go to a community college and then they don't apply for the next step. Or maybe they do have a job and they get promoted and they're like, oh my gosh, I shouldn't have taken that promotion because the job is too hard for me now. Because they've internalized for decades, if not more, that they just aren't that good at something. So I'm not that good at certain things. And that actually feels like part of their personality as opposed to something that it's a treatable thing that they can get help with.